Thank you, Mr Deputy Speaker. I rise to speak in support of this bill, lifting the income limit for Commonwealth Seniors Health Care cards. This March, the age pension was increased by 2.1%, by $20.10 to $987 a fortnight for singles, and by $30.20 a fortnight for couples, taking it up to $1,448.80. While touted by the former government as the largest increase since 2013, the 2.1% indexation lagged behind the Consumer Price Index trimmed mean annual inflation, which excludes large prices and falls, which increased to 2.6% in December 2021. This was the highest it has risen since 2014, according to the Australian Bureau of Statistics, and this means that the cost of living increases are hitting age pensioners' budgets especially hard. The constituents in Mayo, the oldest federal electorate by median age in South Australia and in the top 10 nationally, often my older people in my community often share their concerns with me regarding the rising costs of rents, household expenses, council rates, power, petrol and services. The cost of health services and products are also top of the list of my constituents' concerns, whether it be the rising cost of out-of-pocket expenses for procedures, prescriptions and the diminishing number of bulk billing doctors. In Victor Harbour, where residents, the average age is just over 60, there's not been a general practice which uniformly bulk bills pension and concession card holders for many, many years. And while costs continue to climb, this bill represents one practical way in which we can help ease the financial pressures for older Australians receiving the age pension. This bill will hopefully increase the yearly seniors healthcare card adjusted taxable income limits, including deemed income, and that's going to go from $57,761 to $90,000 for a single person, and from $92,416 to $144,000 for a couple. And this benefit will help 50,000 self-funded retirees who will now become eligible for the Seniors Healthcare Card. And I've got to say, we don't talk enough about the challenges faced by self-funded retirees. And so now they will be able to access concessional co-payments for the pharmaceutical benefits scheme, for medicines, concessional thresholds for the PBS safety nets, at the doctor's discretion, possibly even being bulk billed when they go see their doctor. Co-payments for senior healthcare card holders for PBS-listed medicines will reduce to $6.80 maximum, down from $42.50 for PBS-listed medicines. And they'll also be provided with access to other linked concessions from state and territory governments and private organisations. So this is incredibly welcome. Mr Speaker, this is one of many initiatives that are required to ease the financial distress experienced by many older Australians, and there is much that we can do in this place. For example, earlier this week I moved a motion saying, well, let's let pensioners work without penalty. We know there's a huge workforce shortage in our nation, and this could really be a game changer for both employers and also for older Australians. And National Seniors found that 1 in 5 of the people that they surveyed, the pensioners they surveyed, said they'd be really keen to work again. They don't want to deal with Centrelink and that low threshold where effectively they're earning $37 a day, and then they have to interact with Centrelink or lose 50 cents in every dollar earned of their pension. There are many seniors struggling in our community, some self-funded retirees and some on the pension, and it's our job in here to do the very best for our older Australians. And one other issue, and I hope that the Minister, it's a related issue, I hope the Minister perhaps considers this, is right now, when you're applying for the pension, now you could be in a $5 million home somewhere in metropolitan Melbourne or Sydney, and that if that is your only asset, you are eligible for the pension. However, if you are a senior Australian from rural or regional Australia and you're on 20 acres, you're perhaps on 40 acres, with your house, there are a whole lot of rules around whether you can get the pension. And effectively, for any blocks over 2 hectares in size, unless you fit some criteria, the rest of that property is included in part of your assets. And I don't know if too many people in here have had a small property, a farm or a farmland. You can't make a lot of income on those remaining 15 hectares if you're on a 20-hectare property. So I would urge the government to look at the 2-hectare rule and lift it to 10 hectares. It just makes good sense. Because how can we have that inequity where we have people in rural Australia where the home that they live in is perhaps worth a lot less money than those who are living in inner metropolitan regions of Australia, inner metropolitan cities, and yet one qualifies for the pension automatically because that's their only asset and the other one doesn't. So I would really urge the government, I think this is, I don't know where this rule came from, but really 2 hectares is incredibly small, particularly as a lot of people in their 50s are moving to a tree change. Perhaps they're on 20 hectares and then they get to retirement age and they don't meet the criteria. And so the rest of that property beyond the 2 hectares is considered the ability to make an income from, and therefore they miss out on the pension for that rule. So I would really urge the government to have a very close look at that, and I will be writing the minister accordingly. Going back to this bill, Mr Speaker, this bill goes a long way to assist our older Australians, and therefore I commend this bill to the House.